Okay. I generally forget to do that and then I have to introduce you again. That's why we selected to do that. Okay. So, good afternoon, everyone, and welcome to the case discussion series here. So, it is the 16th in the series, and I'm extremely excited to have Vrushali with us. So, the case discussion series is basically designed for peer discussion and growth for practicing SLPs. So we generally do this as a practice within our educational institutions with our professors or teachers. But once we are in practice, we are not in a habit of discussing with our own colleagues, junior, senior friends. So this is done as a means for SLPs to showcase their skills, what helped them, what was beneficial to the child, to the family, how it was a overall outreach method to make a difference in their lives, not just speech and language goals, and an overall discussion of things. And also to understand where we took a step back, where we recalibrated, recalculated, where our hypothesis didn't work. So the moment we talk to more number of professionals, we get better ideas. So this is the basis of starting this case discussion series. And very, very happy, excited, and proud to have Vrushali with us today. And she was very nice and kind enough to give us the focus, the topic in such a precise format that today, Vrushali, we are blessed to have even 4 or 5 parents attending who personally texted to say that our kids exactly fall into this, that they are 8, 9, 10 years old and they have very limited verbal output. Can we also join into this? So just informing you that we are really grateful and blessed to have few parents also joining us apart from many other SLP. So Vrushali has completed her MSc SLP from Aish Mysuru and has her trainings and certifications in prompt level 2, OPT level 1, sensory motor approach to apraxia, and staying regulated for success by top tools. She specializes in sensory integrated child-centered therapy with her expertise laying in apraxia, motor-based speech development, and articulation therapy. She collaborates closely with parents and caregivers to strengthen communication through movement, play, and meaningful everyday routines. So, welcome, Vrushali. Thank you for building up this case for many SLPs to discuss, and it is going to be recorded. So, many of us will be learning from this later also. I request you to share your screen.
Thank you so much for having me here. I'm very excited to share this child's journey. Just a minute.
Yeah, no issues.
Is my screen visible?
Yes.
Okay. Hello, everyone. Good afternoon. My name is Vrushali Shinde, and I'm speech language pathologist. And today we are here to discuss the case titled From Nonverbal to Emerging Verbal, highlighting sensory integrated speech intervention in an 8-year-old child with autism and complex communication need. And this will show us the progress from regulation to meaningful communication. So we are going to start first with our background, initial profiling, and clinical reasoning. Then I've divided this intervention in 4 phases. First is regulation and sensory readiness. Second is auditory processing. Third phase is visual support. Fourth phase is speech imitation and verbal emergence. And finally, we are going to look into the outlook and through the lens of complex communication need. So, this child was diagnosed with Autism Spectrum Disorder and was presented with complex communication need, meaning that the speech alone was not sufficient for her to functionally communicate. So, she was nonverbal, meaning that there was no communication intent. Either it be by dragging her parent, either it be by pointing, or showing something, or even gestures, and she was constantly self-focalizing. Again, that was not meaningful at all. It didn't have any communicative intent, and that's why she was nonverbal. Next thing I saw was poor auditory processing. meaning that she was not able to listen. She was not able to process auditorily the information we are giving her. For example, giving her commands. She was not able to process it. And that was because she was continuously self-vocalizing. Third is highly sensory seeking, especially for movement and visual input from the screen. She constantly wanted screen. She constantly wanted movement to be regulated. She was seeking it a lot all over her body in terms of movement, in terms of her pressure in her body, in terms of touch. So because of this combined sensory and communicative barriers, she clearly met criteria for complex communication need. So I started this intervention on this one principle that when the body becomes organized, the brain can listen. And when the brain can listen, the speech can begin. Okay. So when I started to assess her, I saw that her main primary barrier was not the lack of language. It was not because she was not able to communicate, because she don't know the words, because she don't know what the thing is called. Example, this is cat, this is dog, this is chair. It was not because of that. It was mainly because of sensory dysregulation. And that's why my therapy started with sensory integration framework targeting three main processing. First was vestibular, proprioceptive, tactile, and oral sensory input. Now let me tell you what does vestibular means. So there are sensors in our inner ear with fluids. Okay, those are fluids. And when we move our head, the fluid moves, and that movement, that sensors sends information to our brain that our head is in a movement. That's how we know that we are moving forward, we are moving backward or side to side. That is vestibular. And next is proprioceptive. So there are very tiny sensors in our muscles and joints. Okay, and those sensors send information to our brain about body awareness, about what we are, like how much pressure we are putting into some work without even looking. For example, when you push a chair or when you carry a heavy bucket, you don't look how heavy it is, you just carry it. So our sensors from our muscles and joints are already sending information to our brain, and that is giving us body awareness and pressure information. And third is tactile and oral sensory input. In terms of tactile, here we mean that she was constantly needing tactile input on her skin, on her face. Okay, so because the skin comes in contact, that's why it is tactile. And oral sensory input because the child constantly puts things in her mouth like plastic. She will constantly chew on the cloth. She will constantly wanting to grind her teeth. Okay, and that's why my main focus was targeting these three systems. So these three systems provide the foundation for postural control with the help of vestibular for our balance and movement, then again attention, imitation, and ultimately speech. So all these three systems are going to work together. So phase one, I began with regulation and sensory readiness. First was vestibular activity. So as I've described already, what is vestibular? So I started with the swing, which was already there at her home. So I started with the rhythmic movement. I started with the slow movement, then coming back and then increasing the speed once she was regulated, because it was clearly visible that she needed movement, and that was the reason why she loved swing. That was the reason why she constantly wanted to run around. Okay, and then I gave her side to side and slightly twisting swings. I used to twist her and then I used to leave her, so she used to come back to the spot. That gave her a lot of, that stimulated her vestibular balance. Okay, and I focused on the linear and repetitive swinging in order to organize vestibular input and then improve the child ability to stay and visually attend. I also used trampoline for the same. I used wobble cushion for the same. I will show you the pictures and videos later. I have everything recorded. So when I used to make her sit on the wobble cushion, or when I was making her sit on the swing and give her a swinging, and then I used to do a quiet time of listening with her. Because of self-vocalizing, she was not able to quiet self-vocalizing. That means that she was not able to quiet herself because she was not regulated. But these movements helped her to be calm, to be regulated, to be ready, basically. And then she was able to listen and process auditorily. And I will show you how in the videos. Okay. This is the first video I'm showing how I gave her the swing. So when we do the swings at home, we have to make sure that our feet are touching to the ground. The child's feet is touching to the ground so that she gets the center of gravity. Okay, so she is not losing balance. She's getting proper movements. So this was front and back and side to side. So in the other picture, you can see I am holding something in my mouth, and that is this thing called kazoo. Okay, I'll be explaining you about this. So when I was giving her movement, I was using kazoo for her to phonate in this. Okay, because now that she was bodily ready and regulated, she was able to focus on this. She was able to focus on her breath. She was able to focus on her phonation. And the blue thing you see is a wobble cushion I used for her. I'll be showing you the video how I used it with her. Moving on to the next. Then I worked with proprioceptive activities. So as I've already shared what is proprioception, I gave her deep pressures on her body with the help of ball. Okay, and I gave her functional heavy work within her environment because this was a home visit. I was not seeing her in a clinic, it was at home. So I used as much as things possible from her environment. So I gave her ball pressure, as you can see from the picture, starting from top of the back, moving to the end, to the toes. Okay, and then I gave her, she has lot of heavy books, set of books, heavy books. So I used to make her bend down, pick it up, put it on a bed. I used to decide one point to another, moving from bedroom to the living room, picking it up and putting on the sofa outside the living room. Okay, this really gave her deep joint feedback and whole body proprioceptive input, making her feel that she is aware where her body is. Or else what used to happen, she just doesn't know where her legs are, where her hands are. But because I started giving her the simple activities to do, that really gave her deep joint feedback. And that sensor started to send information in her brain and made her aware, okay, you are carrying something, so you have to be careful about how you're carrying it. Okay, you cannot just make it go down. Okay, because that used to happen before we started this. Moving on to tactile input and oral sensory input. So because she needed constant touch on her skin, I started giving a deep pressure touch, like firm hand squeeze, not very hard, but very firmly on her hand, on her cheeks. And this is very beautiful way to tune in with the child because it works wonders. It just makes our kid look at us. Because my main goal was not for her to give me an eye contact. My main goal was to visually attend to the activities we are doing. Okay, so that she can process it better. But when I started giving her this deep pressure touch, it worked amazing. I'll show you the video ahead. Next thing was for oral sensory input. So I used it Z-Vibe. I used Chivi Tube. So I used Z-Vibe to increase her oral awareness and reduce seeking because she constantly wanted to put things in her mouth like a cloth, sometimes her hair, and that's why. And next thing I used was Chivi Tube with her. So because when she gets angry, she starts to hit herself. She won't hit us. She will hit herself. So the endorphins which releases in her brain, unfortunately, she used to love that. That's what happens when child hits themselves, not because they love it, but because the brain gets that stimulus and eventually the child starts to seek that. And that's how child hits themselves. So that's why and hits themselves and starts to bite also. Okay, and that's the reason I used chewy tube with her. Not because she had feeding issues. No, she was absolutely fine with eating. She loves eating. But because she used to bite herself, I started using chewy tube with her. So these all inputs created a balanced state of oral readiness before introducing our vocal and AC activities. Phase 2 is auditory processing. Now that her body was regulated, for example, while she was on swing, while she was on wobble cushion, while she was getting deep pressures in her body, she felt regulated. She was able to stop herself vocalizing for a very brief moment of time. And that's when we worked on her listening ears. Okay, like listen cat, listen dog, just for her to look at it, or just me helping, with holding her hand and modeling like cat, dog. That's it. Not something very difficult. Second thing was I used this kazoo. So this is kazoo. I use this for kids with apraxia of speech, where I want them to phonate the sound oo in this. Okay, but with this kid, I used it for her to get tactile feedback on her lips, to feel her own voice, to get sustained phonation and controlled exhalation. Okay, so in this, if you blow, the sound won't come. It won't come. So you have to say, mm. Okay, you have to say, mm. So when I'm saying, my lips are getting that vibration. When I'm phonating in this, I'm getting aware about my body, about my breath support and exhalation. Okay, so I used to do it from this side. And then I used to give it to her. So the image you saw before on the swing, I used to swing her and then I used to do, then I used to give it to her. Ooh, listen. Your turn. Listen. Ooh. That's how this helped. That's how sensory regulation supported communication. So once vestibular and proprioceptive systems were modulated, her auditory processing began to stabilize. She could finally pause her self-vocalizing and experience moments of quiet listening, and this readiness bridged her body to auditory processing, preparing her for imitation. Let's watch some videos now. So this is a very old video where she was still vocalizing a lot, and I just started her sessions. Here you will see I'm giving her a lot of tactile input and trying to tune in with her. This video doesn't have voice in the start, but maybe you can hear it in the end. Teenage husband given to the country, giving birth to Vrushali, being fired, giving J to Vrushali, listening J to Vrushali, try again, J to Vrushali, listening one, giving flower, try, flower. So as you could see in this video, what was happening, I was telling her listening and looking. Okay, and she was constantly vocalizing. So here one more thing is that she was like self-vocalizing, not because she is liking it, but because that's regulating her. But what I tried instead of self-vocalizing, I tried to give her a tactile input from my side for her to regulate her body better so that she can listen and process better. And in the end, you saw that it was really helping her where her hand was constantly on my cheek. So it really helped her to be quiet even for, 2 seconds or 3 seconds. So that's how I used gave her tactile input. Okay. Moving on to the visual support. So given her complex communication need profile, I introduced Awaz app with her. Okay, not as her main communication, but just to pair symbols with the spoken language and to strengthen the link between visual and auditory input. Other thing which really helped her was visual schedules. So when I made a plan for her, when I showed her, that we are going to do the swing first, then ball, squeeze, listening, kazoo, Z-vibe shape, and then bye-bye time. She got predictability. She understood, okay, the class is going to end. And this is the way that I set expectations with her that this is something that we have to do. And it really helped her to understand, okay, in the start it was difficult for her, but as the time went, she understood, okay, this is the plan and I have to follow it. So this multimodal frame bridged body-based regulation with linguistic understanding, preparing her for emerging verbal expression. Okay, after this phase 4, I'm going to show you more videos. So phase 4 was speech imitation and verbal emergence. How I transitioned the sound imitation into intentional, meaningful word use. So after giving her constantly sensory, motor, and auditory regulation in terms of vestibular, again I'm repeating, vestibular, proprioceptive, tactile, and oral sensory input, her verbal attempts began to carry intent and meaning. She actually started to link and associate actions and nouns. She actually started to visually associate the picture. And she was able to even answer what is she doing. But again, everything happened in a stepwise manner. Regulation was done first and then this. And also a lot of modeling in terms of using her words as well. And the the kazoo and oral tactile input supported a breath control and phonetry awareness, which generalized into emerging speech. Side by side, I was still using Awaz with her to support and model and reinforce the auditory comprehension during speech tasks. So I gave her vestibular input through trampoline. I'm giving her vestibular input. Now at this moment of time, she is at a level where she has started imitation of sounds. Then I'm using kazoo with her. I'm using kazoo with her after giving her jumps. And then I'm using picture cards with her and I'm showing the picture. I am modeling her the sentences. And when I say girl is, for example, girl is crawling, she says crawling. And then I'm immediately asking her, what is girl doing? So she already has an answer. The girl is crawling because that's how command I gave to her. So it's not, I don't want to make it more difficult for the child. Let's watch the video. Oh, please jump. Jump, jump, jump. Okay. Time for kazoo. Ooh. Ooh. Okay. What do you see? Boy is running. Running. Okay. Amazing. Girl is crawling. What is the girl doing? Crawling. Crawling your house. What do you see? Playing with the blocks. Blocks. Yes, amazing. So you can say there are little vocalization, but at the same time she is able to regulate herself because she is on the trampoline. Her feet is like her body is getting that movement of balance, and that's why she is able to use kazoo, and that's why she is able to use her words better. Now, this is a wobble cushion. I make her sit on this and I gave her some deep pressures, and then I gave her commands of picking and putting something on my head. And again, I asked her what is she doing. Okay, so we were working on commands, auditory processing, again using words, linking nouns and action words.
Listen, 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 picking, listen, listening, show me listening, listening ears, listening ears, listening ears, okay, picking green rectangle and putting on Vrushali's head. Putting on Vrushali's head. Wow, that's so nice. Good girl. High five. Okay. Picking blue triangle. Putting on Vrushali's head. Awesome. Picking pink triangle. And I'm hiding. Hiding. You are good.
So she loves hiding. So because first I said putting on Rushali's head, she thought that she has to, hide it also with respect to me. So that's why she did that. But this is really good that she was now able to, regulate herself better. But even wobble cushion was used after trampoline.
Please jump.
Next.
Vrushali, white star. Vrushali, white star. White star. Okay, next. Vrushali, white heart. Okay, Vrushali, white rectangle. White rectangle. Listen, white rectangle. Awesome, good job. Okay, let's draw.
So you can see I'm saying Rushali wipe rectangle, Rushali wipe star, because I don't want her to repeat. If I say M wipe star, she will say M wipe star. Okay, so that's why I gave her a command like, listen, Rushali wipe star, Rushali, and then she says wipe star, and eventually she understood. Okay, I'm directing to Rushali, and that's how I'm telling her to do to wipe the star. That's why the commands were like that. The second one.
These are fishes are. Use your words. Fishes are swimming.
So here I'm giving her tactile cue. Here I'm giving her phonetically also I'm giving her cues to use the words.
Fishes are swimming. Amazing. Last one. These are trolling. Bats and fellows. Listen. These are trolling. Balls. What are you doing? Ball. I'm TV. Listen. Listen. Throw it. Yay, that's my girl. High five.
So you can see she is still self-vocalizing, but again, she is able to regulate herself. Okay, and she is able to listen. That's why I'm commanding her, listen. So she understands, okay, I have to listen. And in terms of when I gave her action of throwing, she is able to throw it now. Before it used to be very difficult for her to throw, but now she is getting aware of her hands, of her body, and she is able to do that action of throwing.
Ali.
Okay. So I think this is the last video I'll be showing. Here we'll see how she is answering what do you want, and I'm modeling her. I'm helping her to answer in full sentences. Okay. And this is again after giving her swings, after giving her ball pressure and trampoline, and that's how she's settled. And also after showing her visual schedule.
Listen, listen. What do you want? You want a bear? I want bear. Okay, you want a bear? I'm hugging. Let's do it together. What are you doing? Hugging. Wow, that's amazing. High five. What do you want? Okay, what are you doing? I am. Yeah. There you go. That was good. Okay, last one. What is this? These are shoes. Shoes. I'm wearing. How? Can you show me? Wearing. Amazing. I'm proud of her. It's Papa's shoes. Okay, that's good. Bye-bye.
So this was the most recent video, and I'm very happy to share. And the mom was also very happy because they waited a lot of time to get, to listen to her speech and her words. But again, I would like to say that I'm also using AC with her side by side because we still need that. She's still needing visual. She's still needing a lot of she's still needing a lot of regulation, and that's why I'm using AC also with her. Okay. So outcomes. After several months, she progressed from non-functional vocalization to intentional symbolic communication, showing readiness for functional speech. So we saw she was able to maintain quiet listening with visual engagement, follow one-step verbal command. She was able to identify and label familiar actions and objects. She was able to use AAC, and that also helped her for her basic needs and choices. She was able to reduce self-stimulatory sounds, and she was replacing with purposeful vocalization, because first it used to be just non-meaningful vocalization, but even now if she is vocalizing, it's kind of meaningful. We can understand it. And then she showed early conversational turn taking and joyful communicative reciprocity. So that's how role of sensory system helped in speech emergence. Vestibular, she got the movement, she was organized. Proprioceptive, she was aware of her body. Tactile, helped her to give a sense of security. And that's how regulation helped in listening, imitation, and speech. Okay. Now, let's look into why she is still in this profile of complex communication need. So because this child requires multiple dynamic pathways for understanding and expression, and she is still relying on visuals, auditory, and sensory support to communicate effectively. We are still using speech, AAC, and other regulation strategies, and that's why her profile remains complex for now. And that's why our goal also shifted from just teaching her speech, but to build total communicative competence. Interpretation. So when I started to see her, and now I really understood that for some kids, it's the body. Okay, so that's why this child demonstrates that speech emerges only after body and brain achieve regulation, when sensory and cognitive system are now aligning with each other. She's getting appropriate input so that she can understand better. She's able to reflect it better in her brain. So by integrating vestibular, proprioceptive, auditory, and AAC support, we established communication readiness rather than directly teaching words. It highlights that speech therapy begins with the body through rhythm, breath, and regulation long before verbal output appears. Conclusion. So when we address vestibular, proprioceptive, and tactile regulation alongside with visual support, we can strengthen auditory processing and prepare the brain for speech. And this child's journey from non-verbal to emerging verbal communication demonstrates the power of truly sensory integrated and multimodal approach. Thank you so much.
So if through the audience, if anybody in the audience wants to ask Vrushali anything, please go ahead. You can put it in the chat box. Alternatively, you could also unmute yourself and ask her. Will you stop sharing? Then you will come in the center of the screen.
Hello. Hello.
Yes, Dipti, go on. She's a parent.
Hi. Thank you so much for the very informative session, and it was great to see the development of the child. Pushpita ma'am knows my son, and I just have certain questions in terms of his vocalization aspects. So currently, like my son does a bit of vocalization and imitates also certain sounds, but there is always a apprehension from his end as well that anything if we are trying it, I know for the first time it's very difficult with the child, but the way the therapist also explained that the continuation, the way it has happened, like the instruments that she used it, how effectively and how frequently we have to use such kind of things in our daily routine. So I know it must be there must be certain ways of integrating these aspects on a daily basis, but just for a record, if you can explain in more detail.
You're on mute, huh? You're on mute.
Yeah, just a moment. I'm connecting this because there's a construction going on here. 1 second.
Yeah.
Am I audible?
Yes.
Yeah.
Please continue.
So, as you said that, can I just know a little bit more about what exactly are we doing? You said he's vocalizing, but what are the exercises have been told for you to do at home?
So exercises in terms like I'm actually doing with a little bit of tongue related exercises. I had those small instruments where you have to move the tongue from left to right.
One.
And I used to use the Chewy tube earlier when he was very young, 3 years, 4 years. But after that, he himself kind of didn't like putting in his mouth himself. So eventually, we stopped using Chewy tubes with him. He doesn't have issues in terms of like eating. I mean, chewing, I would say, not eating. But when the imitation, like when we sit together and we do a little bit of imitation of sounds or something, he is very reluctant to put his tongue in terms of up and down direction. Where actually, while speaking, you know that we have to reach the tongue to the top of our inside mouth, right? For certain swar or something like that. He is very much hesitant, and he doesn't like anything which we use it or probably put something in his mouth apart from that left to right kind of an instrument that we use for the tongue. Rather than that, nothing else.
Are there some words he uses, like just for more information?
So I mean, at home when we speak in Marathi. So for certain communications, of course, for majorly, I speak with him in Marathi and then a little bit of English. So I kind of modelize the sentence. For example, he wants something, then I ask him that, okay, दे म्हण किंवा ऐसा कुछ हम लाईक बात करते हैं. पण त्याच्यामध्ये मग त्याचं तेवढं डेव्हलपमेंट असं असतं की लिमिटेड दे, दॅट्स इट. He will not say that khau de or TV de. So I kind of use the actions as well. Pardon?
When you ask him to say, he's trying to say it?
He tries to nod his head much rather than always trying to speak. So
Oh,
certain words, as I said, ma, la, so he will say ma, ma, ma.
understood.
Then I'll say ma and kind of show him little bit of clues, visual clues. Then he'll say l. So it will take a good amount of time for him to understand and then reciprocate kind of thing.
Thank you so much for sharing so much of information. So what I want to say is that you said that he's not able to touch his tongue up, touch his tongue down. And I feel that he actually has oral sensory issues. And what can help in this is that we can't just go inside the mouth directly. Okay, we need to work on his muscles. And I think it's just not sensory, even motorically, the movements are not happening for him. The brain is sending command, but he's not able to plan those movements. Like, for example, Tumi Manala, that you want him to say malade, right? But he is able to say ma, but he's not able to say la. So that is because the brain is not able to plan the movements in his mouth. Like ma needs closure of lips, learn needs elevation of tongue. Right. So this can be a case of apraxia. I'm not sure, we have to see that properly, but I think he will be really helped with when we guide his motor movements. For him, it won't be like if you show him the picture of a cat, you say cat, he says cat. It can't be that way. Maybe he's understanding that it's a cat, but for him to say it, it's not possible. And also, I feel, why is he not letting you do things in the mouth? Maybe before it has been done and he has not liked it. He has not liked it, and his brain has made that connection की मला हे आवडत नाहीये. मला नाही, म्हणजे तो घाबरतो लगेच. म्हणजे ब्रेनचा एक पार्ट असतो, राईट?
Mhm.
Reacts immediately for fear and all those. So that's why it's happening. So what you can do, you can use cold spoons with him. Take some spoons, put it in the freezer, let it get cold. Try putting that cold spoons in his mouth. Let him get that input in his mouth. Okay, and do a lot of this, which I showed in video. Give him a lot of tactile input near his cheeks. तुम्ही
I
बघितलं?
kind of do like this to him, and
Use
this
his own hand to connect with you and then do it on his cheeks. Actually, we have to make it very safe for him. He needs to understand कि हे safe आहे, and that's how he will allow us more to do work over. Okay, and in terms of actually using words, I feel that he really, really needs guidance to his muscles. If we help guiding his muscles, he might be able to use his words amazingly. Okay.
those exercises, the oral exercises outside, like this one, then this one, both the sides, and also certain level of pressures at the jawline. So
Yeah.
those I do it on a daily basis, but not like that frequently throughout the day. So like once in a day time, something like, or probably the time he wakes up, I do it immediately, or while sleeping, something like that.
Still, it's
So
not right.
Not much.
Not
But yeah,
very.
I agree to the fact that it is not very consistent from
Yeah.
my end as well. So yeah, I
But
accept that.
I feel if the exercises are not really helping, we need to do more. It cannot stop till exercises, because maybe he's responding to our exercises, but what is happening here and here through inside? Like, the brain is not able to plan the movements for his mouth. When you're saying tond ugad, he's doing that because he knows that plan. But when you say take your tongue up, he wants to do it. Okay, but there are two things. We have to help him to take it up, but then again we have to guide his muscles. त्याच्या मसल्सला आपल्याला हेल्प करायला लागणार टू मूव्ह इट. ओके, आय एम अंडरस्टँडिंग दॅट तो तोंडात काही घालून नाही देते सध्या, but it can also happen through our fingers and outside. So that is, different kind of therapy. For now, what you can do, you can start kazoo with him. See if he is using this. You have to say it from here, and he has to do it from here. Okay, this will also give him sense of safety and security, that it's okay. And असं नाही की लगेच तोंडात घातलं पाहिजे. We can always start through lips. That's it. Okay, we have to give him a lot of success. Oh wow, you touched it. That's amazing.
Yeah.
It can be here. It can. Like it can take ample amount of time for your child to take it inside the mouth. It's fine. It's absolutely fine. But we need to start doing it by just outer side.
Okay.
And give him lot of success. Very good. I'm proud of you. Very good. I'm proud of you. I love it. You try. If he's doing, it's fine. It's absolutely fine. त्याला perfect करायची गरज नाहीये लगेच. है ना? Let him try on his own. Maybe you can try this, and if you have more doubts, you can DM me so we can discuss it in more detail.
Yeah,
Okay.
sure. Thank you so much. Thank you. Thank you, Debosmita ma'am. Thank you.
No problem.
Ma'am, can I have
Sure.
one
Sure,
question?
Please go ahead.
Yeah, thank you, ma'am. First of all, I congratulate Madam Vrushali, Madam. Really, Madam, it was very nice work what you have did with the child. It's really appreciating. I liked it very much. And many of the points what you said, no, I noted down and I'm practicing. Only the kaju, the musical instrument, what you said, no, that is something new I learned from this session. It is really good, Madam. Actually, with my daughter, the problem is she is actually verbal, but minimally verbal. In a few words, my mother tongue is Kannada, and I stay in Mysore only. And we are attending speech therapist, and also I'm going to Aish for dance movement therapy and all. So my query is like my daughter is having speech, but some of the pronunciation like e, ye, these things she is not properly doing. Especially the articulation part is there, no, like me, no, ma, me. So like this only I'm facing so much difficulty, madam. Is it like it can be apraxia? Some specialists are telling, but they are not sure because few pronunciations are very clear. But with few pronunciations, with although so many practice from past 1 year, I'm not seeing any progress. Is that anything else I can try, madam? I'm going to try this kaju. But in addition, with your expertise, can you suggest so that I can improve her articulation? And many of the words she is trying to say, but it is not properly, means clear. The pronunciation is not clear. So how I can work on that, madam, please?
If you're saying, say, ma, she's saying ma,
Yeah,
right?
yeah, yes, ma'am. Yeah.
This is something is for that. Even if you don't use this for your child, it's absolutely fine. But see, now you
Okay.
said mommy. Okay. So it's like
Uh,
ma, and then it goes me, right? So what is happening with
yes.
the child is like she's not able to change the plane of movement. Okay, she's opening it, but when it comes to doing this, see, it's completely different. She has to put a lot of. So I feel the plan is happening, but
Okay.
sequencing is not happening. And again, the plan of retracting her lips like E, E, B. So you see, I'm
Yeah.
not opening my jaw. I'm just keeping my jaw there and doing this E, me, B, T, key. But with her, she must be getting confused key. I want to open, but when I'm opening, it's sounding ah sound. It's like
Yeah.
right? But again, for the same it's same. See, it's in retraction, just jaw is little bit lower, right? So yes, she is suspected of apraxia of speech most probably, and she needs
Okay.
again the same thing. She needs proper guidance for her muscles. And first of all, we can just, instead of asking her to do E, B, and those sounds and just to join it together, we can start working on just E sounds. E, E.
Actually, that I'm working, madam, now. Yeah.
And
E,
be
A, these only I'm facing problem.
you know, not to be so fast. Be little, patient
Okay.
with her. Be like, E,
Okay.
good. E, very good. E,
Okay.
very good. And then we add, E, very good. Let her do differently. Like, अलग अलग करने दो उसको चलेगा. E,
Okay.
E, and then we can try to join it. Okay, and then comes the
Okay.
bigger words, ma, me. So
Okay.
again, little bit difficult, right? To open, to close, again to retract our lips and sit, and then vibrate, and then do E. It's little bit challenging.
Yeah.
We cannot just do it that way. We have to, do
Mm.
it step by step. And if you
Okay.
do, it's going to be difficult. Do, hmm. Lips are always out. Hmm. Hmm.
Mm.
Hmm. Okay, it's like, hmm. Okay, so we start from E and hmm. E. Be very gentle,
Mm.
take your time, and don't jump on words. If you jump on words, she is not
Okay.
going to be able to plan and sequence it properly.
Okay. Now, how I can fade, madam? I mean, daily basis, 5 minutes like that. I have to practice
See,
doing this.
for this, you have to do it all the day long. But I would suggest in
Okay.
one sitting, do it like 15 times. E, E, E,
10
break,
minutes. Okay.
E, E. Again, do
Mm.
it after some time. But again, honestly, it should be meaningful also. Like, if you're showing a
Yeah.
picture of mommy, you're like, Mom,
Mm.
let us say E, Ma, E,
Mm.
let us say E. Good, you said mommy. It cannot be कि
Mm.
तुम ई बोलो हो गया. It should be
Ah.
meaningful for her,
Okay.
right?
Okay.
So that's
Mm-hmm.
how you can do
Okay.
it. I hope this
Okay.
helps.
Thank you so much, ma'am. Yeah. Thank you.
Can I add something in addition to what Vrushali just said? This is the most demanding activity you can do with your child, whether it is touching the mouth or doing anything oral, especially even if your child is slightly verbal, this is the top level activity. It is like I teaching you embroidery today, and like you said, don't jump to words. You directly start doing the most difficult flower that is possible in embroidery instead of teaching and practicing the basic needle skill on a daily basis. So one speech itself, in children with complex communication needs, where a lot of other kind of support is required, this is the toughest skill you are targeting. So expecting, number one, we are placing a lot of demand on the child. So before you do anything of this sort, what she said, is the regulation taken into place? Is all other kind of communication supported and helped with AC, pointing, everything else? Then when you come and build up and you're able to do a few of these exercises, one day you can do 10 trials, one day it will be like, I don't want to do it at all. So you really need to understand the quality of demand you're placing on the child, and a lot of background digging work, if that has been done, then a child may be ready to give you these responses, basically. So, whether it is even the OT that thing she said, she is doing once in the session. But unless the parent is doing it 3 times a day or 4 times a day, depending completely on the requirement of child as the OT has recommended or something of that sort, it is very difficult to come to these peak responses. So why I give you an example of embroidery is for humans, speech and any kind of finger work is the highest ever any animal has achieved on this planet. Okay, so whether it is surgery, embroidery, very small finger work, it takes up the most of your mental faculties. So if I still need movement, there is no way I will cooperate when even she is helping me so much, right? So one is meaning, one is relevant, also the build up to it. What all has been done before that. So a therapist can tell you do it 5 times a day. But for a parent, that 5 times a day will require, okay, before that, right now, does she need swing or right now, does she need pressure? Or right now, does he require some hugging or some heavy gross motor work? After that,
Yeah.
this time will he agree to do this? So there has to be schedule, there has to be visuals in the schedule, there has to be other routines in place. Then you can,
Yeah.
because what you're expecting is a response from them, not what you are doing. The
Yeah.
response from them is the hardest bit, basically.
Yes, ma'am. Actually, I started working with her from past 5 years, ma'am. At the age of,
Ah,
and when she was 3, from there I have started.
yeah,
So I have seen
yes,
her progress. So I am
yes,
very much confident enough because she has achieved many things which
correct,
previously I never imagined she will do it so nicely. But she picked it very well, although I
correct,
worked very hard for it. But now I am stuck with this. Some of speech is the major thing
yes,
where I am stuck with
yes.
her. Other than that, writing is also somewhat okay. So that's why I just wanted to clarify that. Thank you. Thank
Speech is tough. See, what we are trying
you.
to tell you is that speech is the most tough. So if she is writing, and through literacy you can push more communication, like in the visuals
Yeah.
board, along with drawings, if you have single words, make,
Yeah.
support the child enough, then it is not like the adult is telling me to perform at their will. The child is not
Ah.
understanding that this speech is going to help me. The child does not understand that.
Okay. Yeah, that is true.
The
Yes,
child is like you are with a ruler scale behind,
yeah.
do it, do it, do it, do it, without understanding why I'm doing it. Think back when you were doing cursive writing in every summer vacation and your hand was paying. No idea why your school or your mother was making you do it. Okay. Child does not understand why you are getting those movements repetitively out. So it is difficult for their body also to keep cooperating. So if you help the communication in every other way, visual, AC, if she's
Yes,
right,
I'm trying. AAC also I'm trying. Yeah.
yes, use literacy and AC to her benefit, then she will be okay, okay, fine. There, let my mom try this, let me also try this. Otherwise, always remember the example of instead of just putting the thread in the needle and practice stitching, I'm telling you, no, you have to do that embroidery, that rose flower where all the petals are coming out from the cloth. That embroidery I want in the first step. Why are you not doing it? Remember this? It helps the adults also. No, no, I understand it is not easy for the system. That's all.
Yes, yes.
Emotionally it
In
becomes
your yes,
overloaded and mentally it's overloaded for the child. Oh, and then when they know that they are not able to do it, they go into that ki nahi ho raha hai. They go into that failure and then to get
resistive phase
yeah,
completely. Yeah.
then they come back. It's just difficult. So that's why I said we have to go very slow, and I completely agree with you.
Yeah. So no, this is just setting you up for understanding the parent. Talking to you.
Yeah.
Just setting you up to understand that there are some things that your child will pick up and do it fast, whereas speech, writing, certain movements. Then after that, after many kids start speaking, their volume is not only the mom can understand. These are very difficult for the child. So just setting correct levels of expectations for you. That because you're working so hard, you also want some feedback from the child, and you'll feel that, oh, what I did is working with the child. So it is feedback coming from the child, the performance coming from the child can be really late because they are not able to do it. That's all.
Yeah.
And with respect to the child I presented, she did not have issues in motor planning and sequencing, which I thought she must be having it, but she actually didn't. And her main issue, her main challenge was regulation. But with respect to your child, I feel we need to more work on her muscles and everything and what ma'am said.
Yeah. The focus areas can be slightly different. Yes, absolutely. Absolutely.
Okay.
So, no problem. So, do any of the other SLPs want to ask? Are there any other questions? What I would like to draw all your focus on is, as an SLP, she did not. Yeah, please go on.
I have this message from Anvita. She
Yeah.
said that that sounds were cause effective. If you gave a chewy for that, this is very mixed opinion, and I'm so confused as to what you're trying to say here.
Okay.
Why do you want her to stop vocalizing? Listening doesn't work in neuro. Okay, ND affirming for such an old child who's looking for connection. This sounds more behavioral therapy than play-based. Great effort on using sensory tools though. So yes, so I would like to say that the vocalization in the beginning were not meaningful. It was not even singing songs. Or else I would have thought about Gestalt, right? I would have thought about it because I looked into all perspective. Her vocalizing was mainly, it was not just meaningful, it was something she was trying to regulate herself. If when I was asking her to listen and tell me what is this, if she was wanting to vocalize in a way that Gestalt do, she would have said it in that way. Like cat is jumping or something which she can relate to in her context, right? But she didn't do that, and that's why I tried to do more of listening because I saw that vocalizing was not helping her. That was something which she was just trying to regulate herself. And when we gave other regulations like vestibular, proprioceptive, tactile with to her, she was able to regulate herself better, and that's why she stopped vocalizing. Or else if it was like she wanted to self vocalize and it was kind of gestalt and she was trying to convey herself through that, I would have never focused on listening. because it was very evident that it was happening because her other sensory systems were not able to get that input. That's how I used it. Yes.
For many children, that same vocalization could be stimming. The fact that you're saying regulation, the other side of the coin is just stimming. So what happens is, if this is going on, the child is trying to regulate very hard, this is going on. So if with this, I retain this, I'm not taking this away, and I work on the vocalization into getting something meaningful, whether it is looking, pointing, listen, look at it, then you know that the vocalization was definitely meant as stimming. It was a self-stimulatory behavior that was being done for regulation. Just completing your sentence that if it is regulation on one side, it is stimming on the other side.
Absolutely. And also, she said, also, see, I didn't give a chewy tube for stopping vocalizing. It was because she was biting herself a lot. She used to, now she doesn't. Very rarely it happens where she's biting on her cloth. Okay, but because that's why I used chewy tube with her, not to stop her self-vocalizing at all. And I completely understand for the child of her age wanting to make connections, but honestly, because there was constant stimming, as ma'am said, she was not able to regulate herself because of that, and she needed input from our side, from our environment to get her to that regulation. And that is why self-vocalizing got better. It got meaningful. When it got meaningful, it was absolutely fine. Okay, but when it was not meaningful, when she was herself not understanding what she was doing, she was just trying to do something because she was seeking sense orally also, and that was just one reason why she was doing a lot of vocalization.
So just phrasing it differently, it would be you requesting her to listen while you were doing the activities, or whether when you were on the ball or something, you are basically helping her co-regulate. You are basically getting yourself in the picture for co-regulation, because till then the child does not understand what is co-regulation. The child feels what I am doing is my world, basically. So with co-regulation, there was meaning, connection, relevance, and then the child's attempt to communicate meaningfully, basically. I just want to congratulate you that the drawing up of goals did not start with the child is not sitting, the child is not looking, but you directly started from the basis, the neuroscientific basis of why it looked, how it looked, basically. You did not even start with the child does not listen to one-step commands. It became very evident to all practicing SLPs where you were going with it, but very happy that you did start, and you started with the wobble cushion and not the chair. So yeah, it is really true happiness to see that, because with many other, because there is so much information available these days, especially for parents, we don't understand for what has to be done. So very nicely put, very crisply put. Thank you for your hard work in putting this up for this discussion, for so many people to benefit from this. So this is yes. So this is a very small token of love and appreciation for doing this, for bringing it out for peer discussion. Vrushali, we'll send this to you individually.
Thank you.
And I will just briefly show these to the individuals who are here, that this is what the website looks like. In the blog section, you are going to have this uploaded, and plenty of previous case discussions and other blogs which individuals have willingly either sort of given an interview or spoken. These cases are there. Vrushali is going to be added. It is always going to be there on the website. You guys can go catch up. There are many such discussions from which you are definitely going to benefit something or the other, which is going to help you in your daily clinic.
Just one last thing. Thank you so much for this. I have one more message from Rashmi. She says, should we imitate the stimming sounds to enhance the increased vocalization? So yes, we can try that, but again, it depends on why is she stimming so much? Like, how can we help co-regulate her? How can we help, regulate her in a better way so that instead of stimming sounds, it comes into a proper meaningful vocalization, we can check into, okay, like if she's doing ooh while she's stimming, we can help her regulate and then we can use it in meaningful vocalization. But again, it depends wholly on how her body is, how she is getting the inputs, how she is processing that inputs and, vocalizing. It depends on that.
Yeah, it does. Yes. So extremely like dependent on the situation as well as the individual child that you're working with, basically, many factors to consider. Okay, guys, thank you so much for being here. Thank you so much for participating and making this so much more useful for all of us to carry back. Really grateful for the parents who participated and got one expert advice here today. Thank you, Vrushali, for setting this up.
Much for giving me this opportunity. It was wonderful. Thank you. Thank
Thank
you.
you. So we'll catch up next time over a case discussion. Bye bye. See you. Bye.
Thank you.